we're really collaborating as a community with homeless service providers and with some outside of the box opportunities. Opportunities that we really think are important are to meet new landlords and to kind of open that housing market up, to advocate for more affordable housing.
It's seeing housing or the quality of housing as an upstream determinant to public health is becoming more and more an accepted practice around the country. And we are, in fact, I would like to say, on the cutting edge of that here in central Iowa through what we call Healthy Homes East Bank.
For any unit that was turned into some sort of other type of housing that's maybe more upscale, that for every unit you take out, you have to replace in some way for affordable housing.
I think that there needs to not only be more of an emphasis placed on access to care, but access to quality care where people want to sit down and actually get to know the patients, get to know their struggles, and then understand the resources and things within the community that are available for these people, and will rally people when they see where resources are lacking and where we need to do a better job. One accident, one medical catastrophe, one month without a job can happen to any of us. It is the people that we sit next to in meetings. It is the people that we see at the grocery store. It is our neighbors. And we have to build a stronger community for everyone. So if everyone is prospering and everyone feels purpose, I mean, everybody benefits.
How do we work together with other organizations in the community whose mission is to improve the lives of our residents? And so whether that's public health, whether that's public transportation, whether that's the hospitals, whether or not it's the business community who is looking to make sure that we have an adequate workforce, whether it's the school district that says, hey, we need to really do a better job educating our kids. All of us need to work together.
Everybody of us is part of a community. Nobody's an island, isolated island, that whatever happened to this person will happen to the next. So that's why we were very concerned about how these factors are affecting our staff. And to know more about that is what that we conduct this exercise. It gives us the sense of how they see, how they perceive their patients, how they perceive social determinants are affecting their patients. Also their knowledge about that. We notice that they are very knowledgeable about that. They are very aware of how poverty, how housing, how employment, even we talk about minimum wage could affect the life of our patients. Every day we're trying to fulfill the needs of the health needs of the people in this community. But also it's very important, and I think this applies to any institution, to know what is the needs of your staff and how you can help them to fulfill these needs, how you can help them to reflect about them, and to know more about this. Then will help you to be a better institution, be a better group. Having conversation with your staff is also as important as having conversation with the rest of the community. There are no separate actions. I think they are very good. You combine both, and they will be very good results. In our case, we hope that this conversation will help us to grow as a health department, help this community to get a better place, to get to a healthier place, to be a healthier health department.
Because we know no more than 10% of what contributes to our health comes from the clinic system, comes from formal medical care, comes from going to see your doctor. 10% is connected to our own individual biology and genetics. 30% comes from the lifestyle and behavior choices we make. How much do we eat? Do we consume alcohol beverages? Do we use tobacco products? But half of what contributes to our health are how we build, how we design, the areas where we live, work, play. Tip O'Neill was famous for saying all politics is local. Well, all health is local. We can look to national trends and guidelines, but at the end of the day, what our work needs to look like here, now, is what we decide it needs to look like here and now. As a health department, we have a leadership responsibility in trying to direct the conversation in this community around what it really takes to build a healthy community. The exciting thing is there's so much work going on in this community that is contributing to the same vision. We still think about health is what health departments and doctors do, and economic development is what chambers of commerce and the Des Moines Partnership does, and sustainability around is what the Tomorrow Plan's done. But when you combine what all of us are trying to do, it's around creating community in which people thrive. I think that's health. But what we call it doesn't matter.
So wellness is embedded in all 10 of the capitals, looking from our business capital to our human capital as far as that talent and attraction and retention piece. We really see that it's something that we need to be working on a community-wide level, and even related to our built environment, looking at things such as the walkability work that's going on through the Capital Core and our natural capital with the Urban Land Institute, some of the land bank work that's being started in partnership with the Greater Des Moines Partnership, really looking at the idea that if you don't have a strong home, that creates a whole set of challenges for the future. Sidewalks throughout our region as well are a huge issue. So really seeing that as something that's percolating throughout the community. In fact, we had the opportunity to help facilitate the development of a regional community health needs assessment during 2015, and we had 5 work groups, one of which was the physical environment. The leaders from our local health departments, hospitals, and other entities that are involved with the health and well-being work are recognizing that this is something that we, as those wellness providers, really need to be addressing beforehand so we can really be preventative in our well-being care.
Well, I think the Tomorrow Plan looked at a lot of different aspects of how we can improve the overall health of the communities, along with a lot of other factors in the built and natural environment, and how we can make active transportation part of the planning process so that people are moving more and having a healthier attitude towards transportation. We've been working with a number of our member governments on walkability as well as complete streets policies. Complete streets look at the overall design of a street and how you incorporate not only the moving of vehicles but moving of people, which is really what the transportation system is about. And so that includes vehicles, but also how people can access things through walking, biking, or public transit system. Again, getting to that active transportation system so people are not always dependent on a vehicle to get them to their destination, that they can get to the places they need to go through either walking or biking. I think a lot of people don't move enough in general, and so having those options available where it's easy and safe for them to bike and walk to their destinations will improve their overall general health. The MPO is working with a lot of different organizations, from private companies like Wellmark and Blue Cross Blue Shield to Polk County Health on these different activities, and then Greater Des Moines Partnership, Urban and Land Institute. All these organizations are working on these ideas and partnering together to figure out how we can best implement these systems and make sure we impact people's health in a positive manner.
Our community is not unique in the fact that poor health outcomes are not distributed randomly throughout the community. That sometimes it's related to race, sometimes it's related to age, sometimes it's related to income, sometimes it's related to where you live. But there are patterns in which we see poor health outcomes in certain parts of our community. Having that capacity then helps guide where we invest our time and resources in giving those parts of the community the tools to be healthier. And if we're building a healthy community, then both of us and all of us have the choices and have the support to live out our lives as fully and as meaningfully as we choose. That's my definition, right, of a healthy community. I mean, to make it tangible, right? I mean, it's sort of, people have meaningful, well-paid work. They live in safe, affordable housing. There is reliable, dependable transportation that gets them between their home and their job. And they have access to the resources and support to play as they so choose.
Polk County Health Department is working with a number of other organizations to address social and environmental health determinants with the goal of creating a healthier community for all residents of Polk County.